I'd like to give you a quick overview of what we will be talking about today. I'll give a quick introduction, then I'd like to use an umbrella metaphor to talk about and give you some stories about how I have worked with others to develop coordinated campaigns. I'll also share about the importance of key messages. We'll learn about what happens when messages go wrong, and we'll also look at a case study of strategic messaging with the Tips from Former Smokers campaign, and then we'll leave time for questions and discussion. So whenever I talk and people find out I work at the CDC, I have to go ahead and give a quick disclaimer that everything that we do at the CDC is based on evidence, and we really do try to have science as the basis for the information that we describe. And so I wanted to go ahead and do my government hat duty and share one slide about evidence-based. There actually is evidence for the importance of media campaign messaging and how it is effective at reducing commercial tobacco use. The National Cancer Institute and the Community Preventive Task Force have both conducted comprehensive scientific reviews, and the messages that have been demonstrated to be effective have these qualities: strong negative tone about health effects, the use of personal testimonials, addressing the impact of commercial tobacco use on others, especially as related to secondhand smoke exposure. We care so much about our future, and especially among all my friends in Indian country, we know that our future generation is at risk when it comes to the burden of commercial tobacco abuse. One of the great things that I can share is, based on all of the scientific evidence, adult targeted campaign messaging can be as effective among youth as among adults. Youth respond well to the same kinds of messages as adults, those that show serious negative health consequences and the negative impacts on loved ones in emotionally evocative ways. So if you don't have a whole lot of money and you don't have the ability to just target youth with their own particular campaign, know that the science shows that there's a trickle-down effect, and messages aimed at adult audience will work also for young people. So where do we begin? When we're dealing with media campaigns and crafting key messages, what do we do? Where do we start? How do we even begin to prioritize? Well, I wanted to start with a story about how I came to come up with this presentation and the metaphor for an umbrella. I was at a conference, and it was put on by Cherokee Nation a couple of years ago, and every afternoon they were warning of showers, so I brought my umbrella and there was no shower. And then the next day, no rain. The next day, I stopped bringing my umbrella, and sure enough, guess what happened? The day I didn't bring my umbrella, it poured and poured and poured and poured rain. And so I realized that, people like to do media campaigns, and they like to get coverage for their issues, and they really want to make a difference in impacting commercial tobacco use. But it was at that conference, in that moment when I was soaked full of rain, that I realized that to be effective, you have to have good coverage. And even if I had an umbrella, it would have to be working and all of the folks working for there to be coverage. So I'm going to be using an umbrella metaphor to talk about the power of a coordinated campaign. Media can be a tough storm to weather, but with a little bit of strategy and insight, you really can be prepared and well covered. My disclaimer is that the next slide is very busy, so I want to draw your attention to the left-hand side of the umbrella. As I begin to teach and talk about communication campaigns and key messages, the left side of the umbrella is where we lay our groundwork, our foundation support, and we build our momentum. I'll be speaking today about the power of using community engagement and public relations, and I'll touch on what those mean. Now draw your attention to the right side of the umbrella. I'll also be sharing how earned media and paid media, advertising, and media buys can help you when you're doing a coordinated campaign effort. Also included in not only the coverage, I will touch a little bit on evaluation, and to use a cheesy metaphor, evaluation can give you a handle on your communication efforts. All right, so let's begin with the left side of the umbrella. I'm going to share a little bit about community engagement and public relations. These two things are really the key to laying the groundwork and foundational support for a well-integrated campaign. When we talk about community engagement, we're oftentimes talking about that groundswell of grassroots of how do we engage our partners and work with our coalitions and our faith-based groups, youth groups and church groups and others. Public relations, you'll hear a lot about media and working with members of the media, but I really like to focus on the importance of developing key messages and then training spokespeople and your opinion leaders. So when you're involving members of your community in your campaign efforts, it's very important to decide whom you want to involve, whether it's members of community coalitions, professional groups, any advocacy group. You have to realize that people come with their agendas, and sometimes you really need support and you need funds, but you really have to make sure that you're engaging partners and engaging members of your community in a meaningful way to where their agendas and their focuses do not take away from what you're trying to do when you're trying to reduce the burden of commercial tobacco in your communities. So the best way you can do that is to offer something they want and make it easy to participate. So that is the first element of our campaign coverage umbrella. The second area I'll spend a little bit more time on today as we talk about key messaging is public relations, and oftentimes people will hear working with the media as something that's scary or, oh, I can't do that. But let me tell you, in working with members of the media, you have to understand that just as much as you want them to accurately report what you're doing and wanting to work hard to get their attention, they need stories too, and they're often really hungry for good stories. So what I wanted to make sure that you realize is it's very important to build relationships, whether it's with your tribal media outlets or even in the general population. Get those contacts and build those relationships, then you can be seen as a credible source for information when it's time to pitch stories to the media. You also want to make sure that you respond quickly to unplanned public relation opportunities, whether there's other stories in the news that talk about commercial tobacco, or if there's a particular holiday, whether you can latch on to a Kick Butts Day or a World No Tobacco Day for commercial tobacco abuse, or Mother's Day, Father's Day. Any of those holidays, you want to be able to respond quickly and provide information. Also, you don't want to necessarily focus on pitching an issue. You really want to think about what is your story? Who are you going to talk about? Give your story a face. These personal testimonials can be very powerful. All right. A major component of strategic public relations is to identify and train spokespeople. You want to identify those opinion leaders and then make sure everyone's on board with key messages. I know in the work that I've done in Indian country, elders can be so powerful. Those aunties and uncles and even children can be great opinion leaders. But regardless of who kind of holds the weight and who everybody trusts to go to in the community where you're from, you want to make sure everybody is on board and speaking from the same page. Key messages are simply a limited set of concise talking points used in all campaign activities. And we're going to spend some time talking about key messages because they are really critical to the overall success of any campaign. why do we even need key messages in our campaign outreach? Well, here's several purposes. The first purpose that I've listed is probably my favorite and the most important when I'm training and teaching people. We want to make sure everyone's speaking from the same page. Good strategic key messages can also help you anticipate in advance any controversy, negative opinions, adversity, or questions. As I mentioned before, when you have key messages developed, you get to be the effective voice for your campaign and a credible source for media relationships. I like key messages because you can use them in a variety of settings. Once you've created a key message, you can have it aired on a radio talk show. You can have people place it in an opinion editorial, op-ed piece. You can have it listed on all of your brochures and in any of your outreaches. Key messages can go wherever you go, and they are imperative for any successful campaign initiative. Developing key messages. I want to stop right here and tell you a story and introduce the concept of a message map. So everybody has to think back to where they were on that terrible day of 9/11/2001, and we can probably all remember where we were and remember how horrible and just traumatizing and tragic it was to hear about those planes hitting the World Trade Center buildings. And one person really emerges in my thoughts of someone that really spoke from the heart and really had it together on that day when all of us were just struggling to breathe. And that was Mayor Rudy Giuliani. Now, there's been two schools of thoughts about Mayor Giuliani on that particular day. Some people would say, how could he even talk or give words to what's going on? It's such a horrible, tragic day. Why would he get up here and sound so poised? But most of us were like in awe and be like, wow, Mayor Giuliani, he said exactly the right thing. Well, I have to tell you something and kind of bring the curtain back on the Wizard of Oz. Mayor Giuliani and the mayor's office had been preparing for the unlikely event of a terrorist attack in New York City for many years, and part of their preparations was something called message mapping. It's a tool to help you create key messages and sound bites so that when something happens and a microphone is in your face, you are ready to speak. And these people from the mayor's office rehearsed and practiced and really believed these key messages long before the tragedy happened, so that on that horrible day, Mayor Rudy Giuliani got up there and started speaking from the message maps that he had memorized but had gotten so into the fabric of who he was. It was so calming and so comforting for many people. So he basically did a message map, which is 27 words that take about 9 seconds to speak, and he used about 3 key messages. It's called the 27-9-3 rule, and how I remember that is 3 times 9 equals 27. So basically, you're wanting to develop 3 key messages, and you want to make sure that they're not too wordy, because you don't really want your soundbite edited by the media. You want to control what gets put out there. And you want to make sure that you can say it in about 9 seconds. So how do you decide what to say first? We use the 1-3-2 rule. So the very most important message that you want to get across and remind people of, you say first. Then you followed it by the third, and then you end with the second most important message. In a message map, you want to avoid unnecessary absolutes or negative terms or imagery. And you want to make sure that each of your 3 messages could stand alone. That way, if you have a microphone in front of your face and someone's taping you, or you're trying to speak out at a coalition meeting or a tribal council meeting, or anyone puts you on the spot, you will at least remember one of your messages that can stand alone, and you'll be ready when the time comes. Now, don't be afraid. This is what a message map really looks like in real life. This one was written in 2007 by our office, and it was about smoke-free policies. I don't want you to read all of the boxes. That would take too long. But the most important thing to look is across the middle of the screen. It says key message, fact 1, fact 2, fact 3. That's our message map. So basically, the message map read, smoke-free policies protect the public. All people deserve to be protected from secondhand smoke. Smoke-free policies receive high compliance and public support. But what you see underneath each message is supporting facts. And when you're developing a message map, that's very helpful so that if anybody asks you to expand upon and they ask you for more information, you've built that into your message map. Now, what I tell everybody in our office, and I'm in the health communications branch, so we do a lot of campaign work, is that learning 27 words is not that hard or somewhere in that ballpark. And I really encourage people in our office to memorize our messages. And you can encourage people to do that too. But it's not that easy when you see this big screen right here. So I basically think that why start from scratch when somebody's already created a lot of messages? So if you're not sure where to start, there is a silver lining. Here are some key messages, some samples that we use in our office. This is the message map that I have memorized. Damage from tobacco smoke is immediate. The chemicals in tobacco smoke pose a danger right away. There is no safe level of exposure to tobacco smoke. So you can see, if I had to say that at a meeting, or I wanted to put that on a brochure, or I wanted to include that on a radio interview, or if someone put a microphone in my face, I would be able and ready to use that messaging. Now, you can use this messaging too. It comes straight from the Surgeon General reports, and I've included the reference below. Some other messages that we've used in our office. Smoking longer means more damage. Tobacco smoke poses a threat to families, and the sooner you quit smoking, the more damage your body can start to heal. I wanted to mention that the National Native Network has begun creating a message map as well. And here are some sample messages that you can use. And I wanted to mention a spoiler alert. We will be sending these out. The National Native Network will be sending these messages out along with the key supporting facts. Probably at the end of this week, we will go live with another round of our campaign this week. And when we do, I've been told by the leadership of the Native Network that they will be sending messages and things to support the campaign. So you guys are getting a preview. These are the 3 messages that the National Native Network wants to emphasize. It's the responsibility of Native American leadership and communities as sovereign nations to protect our people from all dangers that lead to unnecessary and premature death, including exposure to secondhand smoke. With sovereignty comes responsibility. We must ask, are the revenues worth cost of reduced quality of life or life itself to our own people? All right. So far, we've learned about the left side of the umbrella, community engagement, public relations, and how to create key messages. Key messages are also critical on the right side of the umbrella when we talk about earned and paid campaign activities. So remember, we don't want to have one side of the umbrella without the other, because if you have rain and only half of your umbrella is working, you're going to get soaked. The important point for me to really emphasize here is that coordinated effort, not just choosing one piece, but all of them. So next we're going to learn about the components on the right side of the umbrella. The right side of the umbrella allows us to provide exposure, leverage, and consistent messaging in our campaigns. Earned media, I'll spend some time on today and tell you what I mean by earned media, but it's basically what a lot of us have had to be really good at doing because we didn't have much money. You just didn't know that they had a fancy word for it. I actually got started in my public health career doing a lot of earned media. I grew up in a very rural community in New Mexico, and we didn't have a lot of money for campaigns, so it was all of those non-paid, value-added news stories, those things that you do to really get your message out when you don't have a budget. But when you do have a budget, we'll also talk about how to best use your budget with advertising and media buys. All right, so let's start with advertising and media buys. The most important component, I'm not going to spend a bunch of time on the actual nuts and bolts on advertising and media buys. There's so many presentations that could tell you more about strategy. From a coordinated communication campaign perspective and from key messaging perspective, I would say the most important thing when you're doing any advertising or media buys is to really know your audience when you're determining what channel to use. Do people listen to the radio? Can you afford to place on TV? Where would you place your print advertisements? Would you want to go digitally? Would you put your advertisement on a YouTube channel? Will you engage people on Facebook? So know your audience, and then you can determine your channel. Test your messages. Now, you don't have to have a lot of money or sometimes even any money, but you have to be able to ensure that your materials and messages that will communicate clearly and persuasively with your audience. And the only way to do that is to place those messages and those concepts in front of the people you're trying to reach. So if you're trying to reach smokers, you need to find a group of smokers to test these messages, because you don't want to spend a lot of money and find out that the messages aren't going to reach your intended audience. If you're trying to protect children from exposure to secondhand smoke, you may want to grab a group of parents. Maybe while youth group's going on, you talk to the parents and find out if messages will resonate with them. Next, you'll want to target your placement. I always say you have to figure out where is your audience? Where do they hang out? What do they watch? Who do they listen to? Maybe it's a coin-operated laundromat. Maybe it's an IHS clinic. Maybe it's a post office. Maybe we found out for our campaign that we're trying to reach smokers. A lot of them end up at the pharmacy going to get their medicines, or they end up at the doctor's office a lot. So then you have to be strategic and decide, do you want to spend money creating a new campaign, new messages, or use existing campaign materials and save your money to actually place them, pay for printing, things like that. All right. The fourth area of our umbrella for comprehensive, coordinated campaign coverage in our metaphor of the umbrella is earned media. When I talk about earned media, consider all kinds of media in your strategy. For example, as I mentioned, Facebook, websites. Think about how you can get your messages out to hair salons, if that's where your audience is, Head Start locations, all sorts of, just think about all the different places where your audience are, and think about all different types of media in your strategies. You'll want to outreach to 3 particular groups. Stakeholders, which may be people that have money to give to you, or a voice to give to you, whether it's being able to speak at a tribal council or being able to speak to a coalition group. Opinion leaders. Who are your opinion leaders, and how can you outreach to them so that they can become message ambassadors? And then how are you going to outreach to your target audience? Your stakeholders need to hear your perspective and your issues to get it on their radar. You can use opinion pages, op-ed pieces, all of those things that we've been talking about. And you also want to reuse the news. If there's been an article or you've heard something going on about a commercial tobacco abuse topic or secondhand smoke or multi-unit housing, reuse that news, share the articles, try to put a local spin, and really make sure to use your key messages and you're preparing talking points for your opinion leaders and stakeholders to use. I can't say it enough, earned media is an integral part of a campaign, and it's a way to get your messages out there. It is really priceless. All right, so we've talked about the 4 spokes on our umbrella, but we haven't yet touched on a very important part. Evaluation gives you a handle on your campaign efforts. It's really critical. Evaluation can help you maximize effectiveness, refine strategies, improve your campaign efforts, and report outcomes to stakeholders. The really key point I wanted to bring up here is that it's important to find, you may not know anything about evaluation, and that's okay. There are some great evaluators in Indian country. You can also connect with college, university students or others that really understand evaluation. And if you know nothing about evaluation, get those people on board early. Get those evaluators on board so that you can either collect baseline data or they can kind of give you an idea of where they need to be involved and how to maybe even midpoint in your campaign change strategy to improve the impact of your campaign. Regardless of whatever your program initiatives and goals are in reducing the burden of nicotine abuse and commercial tobacco abuse, the goal of a comprehensive campaign is really to move the needle. So if you're at one point, to just keep pressing and moving forward. And so we want to make sure that that is happening. All right. Now, we've talked about a lot about the importance of developing strategic key messages that will resonate with your target audience. But what would happen if you skip some important steps? I wanted to talk about how sometimes there can be negative consequences. I have a great friend in North Carolina. Her name is Ann Staples, and she's phenomenal. She graciously is allowing us to see an example today of what happens when they got in a hurry and had to skip steps. Now, I'm going to read straight from her words, and she said she definitely wanted to share her big oops to everybody because she doesn't want it to happen to you. Now, before this oops, Ann did some fabulous campaigns, and since this oops, Ann has done incredible campaign work. But this can happen to anybody, and I think it's sometimes good to see what happens when messaging goes wrong. So let me get up this slide. I'm going to read straight from Miss Ann and tell you her story. As you can see, there's somebody holding a cold turkey. This is what Ann had to say. Why does bad media happen? It happens when, because of a tight budget or tight schedule, you skip important steps in the process. I can tell you from experience, Ann says, you can't skip the steps of learning about your intended audience or testing your key messages with them. The poster you're seeing before you is part of a disastrous campaign I was involved in 2005. We had a good budget, but we didn't have much time. We had to unveil a campaign aimed at college students to introduce the North Carolina's new tobacco quit line. We had some concepts from an ad agency and only a few weeks to develop the full campaign. One of the 3 concepts involved the idea that while many people quit smoking cold turkey, many more could be successful if they use the quit line and the evidence-based support quit coaches provide. You see the fully developed idea here, people being burdened with their cold turkeys when they could be getting help from the quit line. There was no time for us to test the materials. So we set them before a few college students, all health education interns, and they said, we love the message. Great, we said. So let me turn to the next page. Posters, a theater slide, a brochure, and an entire website were developed. The calls started coming in almost immediately. The first thing we learned, Ann said, there's no Spanish translation for the concept of cold turkey. Even Spanish speakers who also spoke English didn't get this, and they thought it was a food safety message. The next thing that we learned, our Native American college students said that they didn't have a cultural concept of cold turkey. The image made no sense to them. The next thing we learned, most folks in the 18 to 24 age range, regardless of race, in North Carolina were not familiar with the term cold turkey. College students everywhere thought that this was a food safety campaign and were calling to get information about how to prevent food-borne illness. The print was too small, the largest text doesn't mention smoking, and the Quitline logo was too subtle. Oops. Anne says this was a $150,000 oops. And she said, and we really couldn't take it back. We didn't have any other materials to promote our North Carolina Quitline. We still have hundreds of posters and thousands of the brochures years later. We blew it, and what's worse is we knew better. Now, I don't want to beat up Anne because she's done a phenomenal job, but she definitely wanted you all to see what happens when you skip steps in your campaigns. So I wanted to let you know that we have, in the federal government, for the first time ever, last year, we created a national tobacco education campaign. For the past 30 years, there's been no mass media campaign effort at the national level to educate public about harmful effects of smoking and encourage people to quit. I'm going to use the campaign tips as a model or case study since we've learned all of this firsthand. And we've tested the messages with smokers, and we've had such a successful first run of the campaign that we're actually in the midst of a 2013 phase, and that I'll get to share more about. But this campaign serves as an important counter to the nearly $10 billion spent annually by the tobacco industry promoting their product. So I wanted to use the TIPS campaign as a case study today. So we had 3 campaign goals. We wanted to make sure that we used the whole umbrella. So we wanted to build public awareness of the immediate health damage that's caused by smoking and exposure to secondhand smoke. We've been encouraging smokers to call our Quitline or visit our website for free help, and really also encourage smokers not to smoke around others and non-smokers to protect themselves and their family from exposure to secondhand smoke. So to go back through the umbrella metaphor, the Tips from Former Smokers campaign did a lot of community engagement. We engaged national, state, and local partners in various ways. They have issued joint press releases, have written supportive letters to the editor, and even sent emails to constituents. It's been so helpful to us. We've also had many local former smokers personalize the message in a variety of states and communities, and we're encouraging others to do this. So that's an example of how we use the left side of the umbrella. We also have done a lot of public relations. Just as I mentioned, the importance of writing strategic key messages, these are the 3 messages of the Tips from Former Smokers campaign. Smoking causes immediate damage to your body, which can lead to serious long-term health problems. Now is the time to quit, and if you need help, free assistance is available. For every person who dies from tobacco use, another 20 suffer from 1 or more serious smoking-related illnesses. So this picture is actually really cool. In the center, in the uniform, is Surgeon General Dr. Regina Benjamin, and she's surrounded by many of our former smokers from the first round of the TIPS campaign last year in March. We did a whole lot of media and PSA placements. So we did paid, but did you know that our publicity value, where we didn't have to pay a penny, I think that I've heard now that it's $15 million, but just to be careful, I put $13 million of publicity value. So our impact from our campaign was immediate and intense. We've had a lot of non-traditional public service announcement placements. We've had our ads placed in grocery and pharmacy displays, in doctors' offices, on healthcare networks, and even at check cashing centers, and all of this for free. We knew that we were using taxpayer dollars and needed to be good stewards, so we had to develop a multi-pronged approach to our paid media flight. So we used TV, radio, print, and what they call out of home, which is theater, billboards, bus shelters, all of that to do our national tobacco education campaign. We also did digital buys, online video, search, display, mobile, and even YouTube. I wanted to show how I've been talking about the power of a coordinated effort, and I wanted you to see how the Tips from Former Smokers campaign fits into the piece. So on the left side, as I mentioned, we engaged a variety of partners and had localized testimonials for community engagement. We developed our key messages, our spokespeople, and worked with members of the media for public relations. You saw all of the earned media that we were able to grab, and you saw what avenues we did with advertising and media buys. We also conducted an independent evaluation of the campaign, and those results are going to be reported out soon. But overall, we had huge success in the first round, and it has encouraged us in our efforts this year to go into the next phase of Tips from Former Smokers. So we have embarked beginning on March the 4th to do a second round of the Tips from Former Smokers campaign. In this next phase of the Tips campaign, we are emphasizing the impact of smoking on people. We're also featuring some new disease categories. Last year, we had heart disease and cancer, and we had several individuals with stomas, and we've had some amputees. This year, we're also including COPD, emphysema, diabetes, and asthma in adults. We're also featuring new populations. I'm happy to report that we will have an American Indian and also an Alaska Native, as well as LGBT and more secondhand exposure ads. We're currently running our ads every other week, and new creative will launch next week. So we're really excited. I wanted to also mention that, let me get my notes, that all of the ads will include very clear and encouraging messages to smokers that they can quit, and that free resources are available by calling 1-800-QUIT-NOW or by accessing the TIPS website, cdc.gov/tips. The ad package being developed includes TV, radio, print, online, and out-of-home ads, and also Spanish language materials have been produced. So we're excited about this next phase. So those are the media channels that we're using. And we're really excited about the social media channels, including Facebook, Twitter, YouTube, and Pinterest. And those are the resources that are being included on the ads. We have a Spanish language portal this time around as well, which is exciting. All right, I wanted to mention that we've begun an initial conversation with some of the leadership at Indian Health Services, and we are excited about how we might be able to utilize the Talk with Your Doctor initiative in tribal communities. Let me say that the goals of the Talk with Your Doctor initiative are to engage the healthcare community, encourage patients to talk with their providers about quitting. It's an additional component of the TIPS 2013 campaign, and we're really trying to encourage more engagement with the medical community. Our primary partners will be conducting specific activities to alert their membership to the campaign, and will help to prepare doctors and clinicians to better address commercial tobacco abuse with their patients. Resources that CDC is developing include an overview document about the Talk with Your Doctor effort, some waiting room posters, looped video of ads for waiting rooms, a Medscape commentary training on how to conduct brief tobacco intervention. We've also included downloadable buttons to the TIPS website from other websites and sample tweets and Facebook posts. CDC will also be providing template press materials, newsletter content, map articles for these organizations to take and tailor for their patients. The materials will be available in May on the TIPS campaign website, and we're also devoting 1 week of our paid media TV campaign for the ads to be tagged with a Talk with Your Doctor call to action in May. So we will be tagging it with Talk with Your Doctor for more information about quitting. As I mentioned before, we are engaging Indian Health Services, and we'll be able to tell you more about that as we learn details, but that's an exciting effort that will happen in May. I wanted to mention that there are several places to get TIPS campaign resources. This slide is, while it's busy, it's meant to be a poster to be helpful, and we have used this in other trainings to help people know where to find what they need. If you're wanting to run a paid media effort, whether it's to place any of our ads or grab the radio advertisements and use them in your communities, we have the Media Campaign Resource Center. So that's in the first column. The second column is really awesome. We have something called a Download Center. And starting this Thursday at 10 o'clock, we're lifting the embargo that we have for the new media campaign materials. We have all sorts of materials that are free that you can go and download from the Download Center. You can print materials such as posters or flyers. When you have no money for your campaign, but you still want to help leverage the campaign in your community, you can grab low-resolution images. There's even a looped presentation of all of the campaign materials, and we have all sorts of great resources there. When the Talk with Your Doctor initiative launches in May, we'll also have plenty of items that you can download. And then, of course, in the orange on the right-hand column is our campaign website, www.cdc.gov/tips. And this has all of a great way to get to know all of our ad participants. You'll get to meet our ones from the first initiative and the 2013 initiative. All of our new campaign materials will be uploaded on March the 28th at 10 a.m. and you'll be able to get fact sheets on the disease categories, bios, B-roll, and connect to our social networking sites. So basically, this ends my presentation, but I wanted to make sure to leave plenty of time for questions and discussion and put it back over to Seth to facilitate this time to see if anyone had any questions.
Like I said earlier, we'd like to very much thank you for your presentation. We'd also like, if anyone has a question, I can unmute that person individually. And the reason we don't unmute everybody is because there's a lot of feedback when we've done that in the past. So if you'd have a question, you can either type it or you can raise your hand using the raise hand button and I can unmute a person. And if you don't have a microphone, if you type your question, I will then, of course, ask it for you. So do we have questions for Michelle? Well, Kim asked, can we post, excuse me, the resources that you were talking about to keep it sacred when they're made available?
Absolutely. We really encourage the sites to co-populate. I can take this offline, and Kim, I'll get with you the best way to be able to link the information that we have on the TIPS website to the Keep It Sacred website so that they co-populate on both sites. So I'll make sure to help you figure out the best way to do that. But the answer is yes. I'd love to get our stuff on your site.
June Mayer says you did a great job.
Thank you, June.
And Shannon Hughes also said Michelle's done a great job breaking down the information into a usable and understandable format. Andrea says, thanks for a great presentation. Does anyone have any actual questions? Okay, we will also be making copies of this presentation available at Keep It Sacred in a few minutes. We will also make a recording of this webinar. It will also be available at Keep It Sacred. Do keep in mind that there will be a post evaluation which will come to you by email within the next few days via SurveyMonkey. We'd like to also thank you for attending this National Native Network Technical Assistance webinar. If you'd like to see any other topics offered, please do contact us at Keep It Sacred. If anybody has a webinar that they'd like to see in the future, please also do contact us. And Kim also has a question. Can we post the ads on the website? I'm assuming she means the video ads.
Um, there is a YouTube channel that we can certainly get you to link to, where we have all of the radio ads, podcasts from the CDC podcast, and then we have our YouTube channel as well as our Facebook. So yes, there are ways that we can have you guys link and be able to show them. We can also get you through the download center. You can be able to place them up on your website.
In the past, I think we've just linked to your YouTube channel. You can actually embed a video from somebody else's YouTube channel on a website, so that's what we've done in the past, because we want to drive as much contact and content as to you guys as possible. Paige Risser has a question. Are there any tribal success stories you can point to, recommend that we check out?
Oh, that's great. Well, I have to think about this for a second. I know that Andrea Thomas in the southeast Alaska area had told me that she was able to use the Tips from Former Smokers campaign, and they created their own Tips from Former Smokers from some Alaskan natives, and they were able to post their posters and flyers all over the place, especially post offices, if I'm not mistaken. And she has just boasted about how having that personal testimonial had really helped people to connect and encourage people to call the Quit Line and to enroll in cessation programs. So that's one that I can think of. But I know of several of our tribal support centers as well as other tribal communities that have really taken key messages and have used them. I've done several trainings in Oklahoma with several of our tribal communities, and I've heard many great testimonies about how people are using key messages for their multi-unit housing, because when it comes to policies and even some of the tribal regulations, it's really important to have those messages down. So those are a couple of testimonies I can mention that were very powerful about once people get those key messages, how to use them to drive callers to quit lines or even to action in the realm of policy.
Does anybody else have any questions? Oh, Paige says thank you. One more. I think she's typing. Hold on just a second.
And Paige, you're also welcome to email me at mjohns@cdc.gov, and we can start a longer conversation on this as well.
Kim Alfred says, we would be very happy to post any success stories on our website if anyone wants to submit them. We are always happy to post success stories on Keep It Sacred. They're extremely popular. Paige says, how about tobacco cessation classes? Has that been successful in any tribal communities you're aware of?
I have heard a lot about people using the American Lung Association's program as well as the Second Wind, and there have been a couple others. June, if June can, she can write me too. I know June Mayer and I have been talking about this with Cherokee Nation. There was a guy that was done with the state of Oklahoma for cessation resources in Indian country, but it's gotten a little outdated. There are some really great programs and a lot of really awesome success stories that have come out of the cessation programs that tribal communities are using. So I think June would actually be best, but Paige, we can certainly connect with June and figure out what some of the tribal communities are using. But those are the two that come to mind.
Paige says, great, I appreciate it.
Well, I just wanted to thank everybody for listening in, and I really enjoy teaching and training, but also learning so much from all of you. So if anyone wants to contact me, we can continue the conversation. And I do encourage you to post your success stories on the Keep It Sacred website. They are wildly popular. People love hearing and building on successes from others.
Rick Frey has a question. It says, came in late, sorry if you mentioned this. Where can I find out about efforts to make casinos smoke-free?
I am unaware of particular resources. I know that ANR does that, but from the CDC angle, unfortunately, we are very much about awareness and education. But I know that there are resources. Americans with Non-Smokers' Rights has a program, and I'm pretty sure Dr. Patricia Nez Henderson in Navajo country has done a lot of work on that topic. The Keep It Sacred website probably has several resources on that particular topic as well.
Kim Alfred has her hand raised. Hold on just a second. Okay, Kim, can you hear us? Kim? Maybe she doesn't have her microphone.
Can you hear me?
Yes.
Yes. Oh, good. I just wanted to echo what Michelle said, that ANR has developed a handbook, or a pamphlet book, rather, on smoke-free casinos, and they are developing a toolkit as well on smoke-free casinos. That's in the works right now. That's all. And thank you to Michelle. It's a great presentation.
You're welcome.
Okay. Yes, the Americans for Non-Smokers' Rights. Rick was asking what ANR stood for. He also says many thanks. So we will be ending the webinar, and do keep in mind that there will be a evaluation sent out probably in the next 24 to 48 hours, so we can evaluate the webinar and make sure that everybody gets the credit where they deserve. And we'd like to thank you for attending this webinar today on behalf of the National Native Network. Thank you, and good evening.